Assalamu alaikum and a very good afternoon to all of you. This is the second section which is about innovation and diabetes care. Let me introduce our panel of experts. Our first panel of experts is Dr. Muhammad Ashraf. He is a public health physician and epidemiologist currently associated with Buckeye Medical University. Please join us on stage. Second panel of experts is Professor Hakim Ali Abro. He is Professor of Medicine at Shaheed Mohattarma Benazir Bhutto Medical University, Ladkana. Third one is Professor Ashraf Fawad. He is Dean Faculty of Basic Sciences at Buckeye Medical University. And the last one of today's session panelist is Professor Yusuf Kamal. He is an internist at Aga Khan University Hospital. Sir, please join us on stage. So the first talk title is about digital fast, how smart tools make Ramadan safer. The first speaker is Dr. Somia Iqtadar. She is Associate Professor at the Department of Medicine, King Edward Medical University. So may I request, please join us on podium.
Thank you, Dr. Saima. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, ladies and gentlemen. I'm really honored and very grateful to the team of BIDE, Professor Zahid Mia and Dr. Saif, for inviting me and giving us the opportunity to talk to you on a very, very important topic, very close to the heart of every Muslim, which is Ramadan, and how can we make fasting safer in Ramadan. This is the topic I've been assigned. So respected colleagues, this is the era of digitalization, and AI is revolutionizing the healthcare system. So let's empower our medical professionals, because AI won't replace doctors, but it will replace those who don't use it. So it's very important that Ramadan, which is a sacred pillar of Islam, and it poses a health challenge to many of us, we have to turn this into an opportunity. And definitely AI can help us in this regard. That's why today we are going to talk about digital fast. So we are going to explore a revolutionary approach to diabetes management during Ramadan. So it's an approach which combines the faith with our health and bridges the gap. So as healthcare professionals in Pakistan, we face unique challenges during this holy month, but technology is offering us an opportunity and a powerful new solution. And how can we do that? I will take you on a journey through the digital transformation of diabetes care, and how will we make our fast safer in the month of Ramadan. So to set the perspective, let me give you the overview of today's agenda. We are going to talk about the challenge of diabetes management during Ramadan, then what is the role of digital technology in safe fasting, and what are the apps and softwares that can help us guide through this challenging time. We are all talking about continuous glucose monitors these days, so how they can help us, and a step ahead, automated insulin delivery system being used in type 1 diabetic patients, but increasingly becoming popular with insulin-dependent type 2 diabetic patients as well. Then what are the new and upcoming hardware innovations to keep us updated with what is coming up? How artificial intelligence and mobile health apps can help us. And then I will be sharing some of the case studies and real-world application, and then we summarize with their benefits and the future vision for Pakistan. So we know that we have to face this harsh reality that Pakistan is the most popular diabetic population in the world, known as the world's diabetes capital. With 31.4% people having diabetes, which is 1 in 4 and 34.5 million pool of diabetic patients in Pakistan, we are ranked number 1 in the world in adult population. And studies indicate that majority of the Muslims living in Pakistan, they choose to fast during Ramadan. So according to data, roughly 70 9% of patients observe the Ramadan fast who are suffering from type 2 diabetes, and about 43% of type 1 diabetic patients, they fast despite the high risks which are associated with this condition. And generally, 73% of all diabetic population, which is combining both type 1 and type 2 diabetic patients, they fast for an average of 20 to 25 days during the month of Ramadan. So that's millions of people at risk of hypoglycemia and also hyperglycemia. So we have to keep in mind both the risks. And our emergency departments see a significant spike in diabetic complications during the month of Ramadan. And these aren't just statistics. I would say they represent us, our patients, our neighbors, our families, our friends who have serious health risks while observing their faith. So how do we bridge this gap? The gap between faith and health. And it is duty of us, the healthcare professionals, to bridge this gap between faith and health. And the answer is now made simple because the answer lies in digital technology. The smart tools are revolutionizing the diabetes management during Ramadan by providing the real-time monitoring and personalized care, which can be called as precision medicine to our patients, fulfilling their needs of bridging this gap between faith and health. So what's particularly exciting for us in Pakistan is how these technologies can work across diverse settings. From urban hospitals to rural clinics, they respect our cultural practices while providing clinical benefits. And I think this is about time that we start adapting them and integrating them in our existing infrastructure in major hospitals and find and optimize the cost-effective solutions for resource-limited Pakistani settings, because only then we can make them viable options for our healthcare system. So let's start with the most accessible digital tools, which are mobile apps. Everybody has a mobile these days. So apps, these are the few apps that I've come across which can be helpful and you can guide your patients to use them. One of them is Ramadan, Diabetes and Me. And this is available in Urdu, and this makes it very easy for the patients to understand. These apps do more than just tracking the glucose. They provide culturally appropriate meal suggestions. They also give reminders for prayer timings, and a direct communication with healthcare provider is also installed in the app. So it is available in Urdu interface with also regional languages and options. And My Sugar, DiabCare PK, and Ramadan Diabetes and Me are some of the useful apps which you can share with your patients and they can use this for guidance. What's particularly valuable whenever we talk about these health applications and mobile apps is the data privacy compliance and integration with our hospital system. So we have both free, which is the basic version, and premium options available in these apps. And this makes the digital diabetes management possible at various price points. They can be integrated through telemedicine as well, and connectivity for remote monitoring is also possible through these apps. Now let's talk about the game-changing hardware, the continuous glucose monitoring system. There's a lot of hype these days because many companies, they are now launching these CGMs, and this has become the talk of the town. The 3-4 CGMs which are available in the market, Pakistani market, are Dexcom, Freestyle Libre 3, and then recently launched Lynx CGM. So we have to be considerate also about the cost of these things because it remains a challenge. Although they are very useful and they help in monitoring the blood patient, but the patient selection has to be appropriate for Ramadan fasting, and the cost effectiveness has to be kept in mind. Also, the healthcare and the patients, they require a small training, although it is very user-friendly, but they require a small training on how to monitor their glucose and track it during Ramadan fasting. So CGM benefits during Ramadan have been studied world over, and this has led to decreased hypo events, improved time in range, and better user satisfaction in many of the studies which are done worldwide. So imagine that your patients, they receive alarms if they have a hypo or a hyper, and this can significantly reduce the hypoglycemic and hyperglycemic events. And research indicates that time in range is also improved, which is one of the markers of good glycemic control, and users have shown a considerable satisfactory rate with the use of these CGMs. Taking this a step further, the automated insulin delivery systems. There are few FDA-approved systems which are now available in Pakistan as well. These are actually artificial pancreas-like system. Tandem, T-Slim, Medtronics, and Omnipod are few of the symptoms which are available. And you require a training for using these AIDs. And the training is becoming now available through different certification programs by the companies which have launched them. And the clinical studies, they have shown that the patients using AID systems have higher rates of successful fasting during Ramadan, and there are a number of publications on making Ramadan safer with the use of these automated insulin delivery systems. You all know that technology landscape is evolving rapidly, and while we currently have access to excellent systems like Tandem, T-Slim, and Medtronics, the next wave of innovation is also coming to Pakistan. And the Twist AID system and Tandem Mobi with Control IQ, they are the new systems which are expected to be launched in 2026 and 2027, and they will be available for our patients as well. So what's encouraging is the growing local distribution network and increasingly cost effectiveness of these sophisticated devices, and also refurbished devices are also available. And there are some insurance companies which are also giving you payment plans for these systems because they are costly. So many organizations which provide coverage to their employees for their treatments, they are now considering CGM and AID as a part of diabetes management. So beyond hardware, artificial intelligence is revolutionizing the diabetes management during Ramadan. The way it has revolutionized the healthcare, the Ramadan and diabetes management is also being linked to AI, and we have to leverage the AI to enhance the Ramadan experience. So particularly what is relevant for Pakistani population is that how these AI solutions work even with limited connectivity, which is very crucial for our rural areas where there are connectivity issues. So the local language support, including Urdu and also regional dialects, we talked about Sindhi and Saraiki and Punjabi. So these local dialects make these tools accessible to more patients. And there are some protocols which are developed for Pakistani patients through clinical decision support system in AI as well. FAST protocol is one of them. And a study has shown that it shows 4 times better glucose control, and implementation in our clinics is becoming more feasible by population. Due to limitation of time, I am unable to share all these studies, but you can search them out, and there are a number of ongoing projects to evaluate the effectiveness of technologies in the Pakistani population during Ramadan with patients with diabetes. So what does all this mean for us as healthcare professionals in Pakistan? So the clinical benefits are clear. There's significant reduction in hypoglycemia. There's better glucose control. And the implementation strategies are becoming clearer with stepwise approach for Pakistani hospitals. They can be integrated with our existing infracare structure, and they can be customized for both urban and rural settings. There are certification programs for providers which are provided by organizations, patient education programs in Urdu as well as in regional languages, and technical support across different networks is also provided. So increasing accessibility of these digital tools across Pakistan is becoming evident now. but we have to keep in mind the cost consideration. Therefore, the suggestions of decreasing the cost with local manufacturing should be our way forward. And there should be government initiatives starting a pilot project of digitalization of these management of diabetes during Ramadan, with spread if it becomes successful. So I would end my talk here by saying that digital tools that transform diabetes management, and particularly in Ramadan, they can create a safe digital fast that allows millions of Pakistanis across the country to observe their faith while protecting their health. But AI integration, local manufacturing, and improvement in national network and customizing it in regional languages will go a long way in making this possible in our country. I would like to take this opportunity to once again thank all of you for being here and for being patient listener, and invite you all to our 7th Annual International Conference of Pakistan Society of Internal Medicine. I see many big names sitting over here who are already committed to join us there in Lahore, but all of you are welcome to join us in Lahore for Pakistan Society of Internal Medicine 7th Annual International Conference. This is in collaboration with Royal College of Physicians London, Royal College of Physicians Edinburgh, Turkish Society of Internal Medicine, Ceylon College of Medicine Sri Lanka, International Society of Internal Medicine, and South American Society of Internal Medicine. We wish to welcome all of you in the festive spirit of Basant in the heart of Pakistan, Lahore. We look forward to seeing you there. Thank you.